So as I find is pretty common when I started to look up anything on the internet around aortic dissection, it was all a lot of medical journals and big words, long studies, not really anything personal that I felt like I could connect with. So of course, I wanted to put my story out there just as I go through this journey. If it helps anybody, of course, that's the greatest. So it was an interesting couple of days for me. I ended up in the hospital overnight, not last night, but the night before last. The condition that they diagnosed me with is called aortic dissection. So I got a little visual aid to help me understand what was going on with my body. So what happened was there are 4 arteries around your neck, the 2 carotid arteries and then the back arteries. And so my back left artery, while typically it is just a nice smooth tube like this, it is made up of layers in the tube. So you can see in this little example that there are, if I can make it work right, there are layers inside. So that's how your arteries are. And what happened with me is one of those layers pulled away from the side. So the risk for this condition is that there's now a little gap there and a little area where blood could clot and build up. And if that clot then released and went back into the artery, went up into my brain, that would cause a stroke. So that's one thing. The other thing is just the discomfort that comes from the blood not flowing from having that pressure block right there. So the way I found out that I had this aortic dissection is I was at the gym and suddenly, very suddenly, I had a pain in my neck pretty high up that was really acute. It was really intense and really targeted, and I hadn't felt anything like that, that particular pain before. So I stopped and took a breath and was telling my husband that I wasn't feeling great. My head was really hurting. And then it started to progress and move up into the side of my head and then up into the middle behind my eyes. And at that point, we left the gym. We stopped our workout. I was in too much pain to do anything. And there was just that sense that this wasn't right. There just wasn't something, this wasn't something normal. And because the pain was so intense, we went straight to the emergency room where they gave me something for the pain, which was awesome. It didn't take the headache away completely. There was still a dull, like kind of throbbing happening in both my center of my head and the side of my neck. But the intense acute pain was gone, so that was wonderful. And then they took me right into CT scan where they found the aortic dissection. So they then decided to do an MRI to check and see if there was any evidence of stroke having already happened, or any evidence that that was in the middle of happening. Luckily for me, there wasn't any evidence of stroke, so that's wonderful. But what they decided to do was keep me overnight to just observe, since this was still kind of just happening, and put me on a blood thinner so that there wasn't going to be any clots building up. Or they would do a neuro exam, so that's really normal. They did one where I held my hands up straight like this, and what I was looking for when my eyes were closed was whether one started drifting or not. So these are exams that I'm going to be doing on myself pretty much every day for the next 4 weeks. Just observing if I have any of those stroke symptoms, any of that balance issue, any change in vision, change in speech, any change in being able to walk, that type of thing. So something that I'm going to be self-aware of after I came home. And then also my treatment after I came home is to take an aspirin. So it was kind of interesting. They were saying that the chances of me having a stroke, if they did absolutely nothing, is 4%. And so then the interesting thing is that they said if they gave me the heaviest blood thinner medication, which comes with a whole batch of side effects, it dropped that down to like 1.5%. But me on aspirin was just about the same. It was in between 1.5% and 2%. So the treatment is aspirin and aspirin a day. I'm taking 325 milligrams of aspirin every day. And oddly enough, the thing that helped with my headache, once I got past the really acute pain, that pulsing, throbbing pain, the thing that helped the most was Tylenol. So I didn't ask to take any other of the narcotics. It's not my preference. There's just so many terrible things that can happen with taking narcotics. And also it just isn't a great fit for my body. I feel really nauseous, and it's just not something that I like to do, as a lot of people I think have that same experience with narcotics. So rather than taking any narcotics, I'm just going to be taking a Tylenol. They did give me a prescription for, what was it? Some narcotic, a prescription for something that if it got to that acute pain again, I could take that. But also if it got to that acute pain, they said I probably ought to come back into the hospital, which I'm sure I would do. So that's the plan as far as like my medication and my just self neuro exams. Follow-up is I'm going to go into my neuro in 4 weeks. I'm going into my regular doctor in a couple of days. Then I'm going to go into my neurologist. And the neurologist that they gave me specializes in vascular neurology. So I'm going to go into him in 4 weeks and have my labs run again. And they'll look at that artery and see if it's begun to heal itself, which is common. So that's what we're really hoping for. And then I'll kind of be able to go to that next step. So it's going to be a little challenging for how I'm managing this, given what I've been doing with fitness for the past 8 to 10 months. I've been doing a lot of high intensity interval training, a lot of heavy weight lifting, and really enjoying it, really enjoying it, loving it, feeling really bummed when I have a rest day. So it will be challenging, I think, for me to have to manage this. I can't lift more than 5 pounds for at least 4 weeks until we start to see if this dissection starts to heal itself. And if it does, then I'll be able to lift some higher weights. And eventually, what the neurologist said at the intensive care where I was that this is likely not forever. This is something that we're gonna have to evolve through, and I'll start with not lifting weights over 5 pounds, then be able to start to see things heal and increase that weight. And you know, he said that in maybe 6 months, once we see that everything is fine, I can go back to life as normal. So that's really encouraging, and I think that is, like he said, it was pretty common that it does start to heal itself. So bear that in mind, any of you who might be dealing with aortic dissection. But in the meantime, my personal choice, what I'm going to do for fitness rather than do nothing, because that will put me in, I think, a major funk. And that never helps the body. I think just like what's going on in your head and what's going on in your soul and what's going on in your body is all super connected. So if you have a chance to keep your soul healthy and your head healthy, it really is going to affect how your body reacts. So to keep my soul and my head and my heart and my body and everything healthy, I definitely still need to stay working out and getting to the gym and finding other ways that I can do some fitness. So what I'm going to do, still erring on the side of caution, is some more steady state, low intensity steady state workouts. So those take a little bit longer, obviously, than high intensity, nice 10-15 minute cardio. It'll be more like 45 minutes to an hour at a lower intensity, which is fine. It is what it is. It's still enjoyable. It's still moving my body. It's still getting the blood pumping. It's still burning lots of calories. So it'll be great. And I may still do some weights. Now I can only lift 5 pounds, so it's not going to be very much. But, you know, I also just think that getting some muscle contraction going is better than none. So I will still be doing a little bit of lightweight, high rep weightlifting. I was also thinking about what I'm gonna do with my macros and my calories, because as you guys might know, I've adjusted my macros and beefed my protein up quite a bit because I was doing so much weightlifting. And since I'm not gonna be doing that, I think what I'll probably do is just kind of level out where my calories should be according to my total daily energy expenditures, or my maintenance calories, if that's a new term for you. I'll put a link below in the description where you can find out what your maintenance calories or your TDEE is. So my TDEE is about 1,500 or 1,600 calories. So I'll just be eating at my maintenance calories, my TDEE, and probably trying to keep my protein up in between 100 grams and 120 grams a day, and then splitting my other macros between fats and carbs. I will probably, just because I'm sort of shifting my eating plan, I will probably track my eating for a couple of days just to get back into the groove so that I kind of feel what that feels like, and then I'll probably stop tracking my calories anymore. So I don't like to track every single day, but every once in a while is still just a good idea to check in and make sure you're not totally going off the rails. For me, what tends to happen is I don't eat enough calories, because for so long in my life, I ate too few calories and my body adjusted to that. My metabolism tanked from that. And then anytime I did eat the appropriate amount of calories, it caused me to gain weight. Yeah, I will be, over these next couple of weeks, as this hopefully starts to heal itself, I will be having kind of a low-grade headache, which I am experiencing right now. It's just kind of that low grade. Today it's here. It's kind of moves from here to here to here. And I can take Tylenol for that if I need to. I just took my aspirin for the day, so I'm gonna wait an hour before I take my Tylenol, but it seems like that is what I'm gonna have to live with every day, is this kind of low-grade headache, so that's super. But it could be worse. The headache that I had going into the hospital was honestly I think it was probably the worst pain I've ever been in, with back surgery, having 3 kids, all those things. It was intense. So I will check in with you guys along the way over these next couple of weeks and let you know how things are going and this sort of new adjustment. It's like life always throws something at you, right? It's just, you got to be prepared and roll with it. The only thing that we can count on is constant change. Best of luck to all of you. Hope you're having a great day, and I will talk to you soon.